Well, gang, this really is a singular moment, not just in the history of DCI, but in the history of everything. Drum Corps International was, of course, several years into an all-out effort to promote health, safety, and wellness when we got hit with this pandemic. Before we get into the challenges that the pandemic itself has presented, let's kind of establish our baseline here. Please, Lori, if you would, give us just a quick summary of the history of the Marching Music Health, Wellness, and Safety Project.
Sure. So the Health, Wellness, and Safety Project started out as the Drum Corps Medical Project, and it was really started by a group of healthcare providers, doctors, nurses, et cetera, from the Cavaliers Medical Group, because they felt like the activity needed to have something like they had. And then in 2010, 2011, DCI began to become more involved and hold it as an initiative, because it was becoming increasingly evident that the activity was just getting more and more athletic. And we really needed to have a more organized approach to how we assisted the corps when they were on the road, and how we moved forward as this activity became more complex.
Say in 2019, if a corps was on the road, could they have pretty much called anywhere in the country to get assistance?
Just about. I mean, we've built a pretty good network, and we're continuing to build, and we need anyone who wants to join in our effort who is an allied healthcare professional.
These medical professionals, many of them, I take it, are giving their time gratis, but this effort takes financial support, doesn't it?
DCI has been great. They've been wonderful. They have supported us to hold events for medical staff so that we can help train them. We've had webinars and other events during the summer. We hold a San Antonio's Midsummer Medical Summit for the medical staff, just to really be able to support them in a way that they need to be supported.
Stephen, you want to comment on that?
Well, I think it's been great seeing how this has grown over the last 10 years or so. Like I said, I came in from this without any drum corps experience either. So I came at it from the point of view of how do we take care of athletic teams when they're on the road? And so we've been trying to blend those two, because basically drum corps is an athletic team on the road. So we have to kind of keep working with that, and then just trying to broaden, like Lori said, the number of people we have working with the drum corps, so they understand the activity and appreciate how athletic it just is.
And it's not just physical health, it's mental health as well, and safety too. We'll get to safety in a moment, but mental health. Jake Levy, you and I have talked a couple of times during the winter meetings about the efforts that have been ongoing for several years now to tend to the mental health needs of marching members.
Yeah, absolutely. But beyond just the things that are related to the activity themselves, we were dealing with, with young people in the height of their, burgeoning adulthood, and they're struggling with the same kinds of things that all people in high school and college age communities struggle with. And taking them on the road oftentimes is not necessarily going to create a problem, but it certainly can reveal a problem that happens. And there's constant challenges, and just trying to help them just be the outstanding performers that they can be, and give them the support they need in order to maximize that. That's the whole reason why I do this, and the whole reason why I think all of us do this. It's for our performers, and allowing them to be their best.
And to be their best, they have to have the best fuel. Lisa Dorfman, I'm a foodie, and I think one of the great stories that doesn't get told enough in the drum corps activity is how food service to marching members has evolved over the last 10, 20 years or so.
Yeah, I mean, I'm new to drum corps, like Steve said he was when he came on board, but I am a lifelong athlete, a former pro athlete, and a musician. And I know firsthand with working with athletes that if you don't get the right fuel in your body, you don't stay nourished, you don't stay hydrated, there's no way that you could have the mental focus, the energy. You have a much more difficult time recovering from your training, preparing for a competition, and just staying healthy. And now with COVID and everything that we need to be concerned about in terms of safety, food safety is such a critical issue. So I'm super excited, and what a team I get to be a part of here. So I'm thrilled. Thank you.
You know, as a journalist and radio personality in Oklahoma, I work with a lot of meteorologists. And just like in our drum corps activity, there are legends like, Lori Van Doren's husband, Donnie Van Doren, for instance, a brass legend in this activity. And we have a lot of them. In meteorology, in this Tornado Alley state of Oklahoma, there is this guy, Kevin Clazel.
Because I know that my involvement started with involvement from marching performers from corps that were in the Pride of Oklahoma, the University Marching Band. And they would come back to my classes, some of them being meteorology students, and saying, oh man, we almost got hit by this lightning and almost got, wind knocked this over and on and on. And they were all excited about it. And I'm like, wait a minute, right? We've got safety issues here that need to be addressed. And I need you guys, right, the meteorology students, to be at the forefront of this. And that's happened, right? We have really seen just an absolute 180 with respect to, it's tough to hear when you're working with a drum corps out on the field. You can't hear thunder. You've got too many things going on. So having the latest and greatest technological capabilities in the hands of DCI leadership and in the hands of many of the corps right now are using heat metrics that are top of the line, right? They are so far advanced over even many other sports teams that it's really an honor to get to work to them because, not because we're a big deal, but because they want to improve. They want to see safety as a primary, and they have integrated that across the board with respect to weather.
Okay, well, let's talk about 2021. What can we learn between now and then? And what can we do to make tour next summer, if it happens, as safe as possible? Lori, you're the chair. Let's start with you.
Well, that is the question, the $1 million question. And I think what we're going to do is we're going to draw from, what we're seeing happen around us in both professional and collegiate athletics. We'll look at what's happening in the theater world in terms of performing and the performing arts, and we'll draw upon what they learn as they go forward as well and collaborate as much as we can. And then morph that into what we think is the most safe approach for our activity going forward.
Dr. Rock?
Let's say, think about where we were just 3 or 4 months ago. We didn't hardly know anything, and how much we've learned during that time. So we have that luxury. We have about another 9 months or so before move-ins. So we have a lot of time, like what Lori said, with all the schools, all the other sports going on, what they're learning, but also as a healthcare provider, what sort of treatments will come about in the next 9 months? Are we going to have better ways of preventing it? Are we going to have a better understanding of how it's passed around, so we can do a better job of prevention? And so there's a lot to learn in the next 9 months. And since we have that much time, we just have to be patient and wait to make decisions, unfortunately.